We're now being joined live by our correspondent, live from Abeokuta, Ogun State, John Felix. Good afternoon to you, John. Many thanks for joining us on Galaxy News at this hour. Let us know precisely what the state government is doing towards ensuring Lassa fever does not get to the people.
Okay, like you rightly said, there's no confirmed cases of Lassa fever outbreak in the state, and immediately the state government has swung into action by ensuring that the state government has placed on alert, red alert on hospitals, religious places, marketplaces, to ensure that in the eventuality there's an outbreak, it is curtailed immediately. So what the state government has done at the moment, massive awareness to residents, to market women on how the best we can actually curtail or mitigate the spread of Lassa fever in Ogun State. One of the things they've done is to ensure that awareness campaign, and also to tell residents that they should not dump their food materials indiscriminately because of the season we found ourselves in. The influx of rodents across houses, across places will be on the increase. So at this point, the residents are expected to ensure that food materials, food items are properly kept. Also the local government areas surveillance, disease surveillance officers have also been placed on red alert to attend to suspected cases of fever. So in the eventuality whereby patients or residents have they have a rise in the temperature level as a result of fever, they have been mandated to take care of every suspected case of fever. So at this point, hospitals, centers, PSCs have been placed on red alert to ensure that people who have perhaps suspected fever are treated promptly.
John Felix, this is not the first time that there's been pandemic and outbreaks of diseases like that in Ogun State. What is the state government doing differently this time around? Should there be any casualty?
The last time an outbreak of such occurred in Ogun State was in 2017, and from the last incident, there were designated points in which people of such cases were moved to the isolation center. I think one thing they've been able to do differently is to involve the local government areas, disease surveillance officers to take care. So you don't necessarily need to come to the designated isolation center. So for every local government, the state has 20 local governments, and even from the point whereby it gets to the designated isolation centers, from the local government areas, they can be taken care of. So we have people at 20 local governments who are perhaps will be the first respondent before they are moved to the designated isolation center the state government has prepared for. And beyond all of this, the state government has also ensured that all its health officers should not return or reject or turn down any patient who has a suspected fever or a suspected case. So there is a mandate from the state government to all the health officers to attend to any suspected person who has fever or a case.
We have been speaking with our correspondent there, John Felix, who joined us from Abeokuta, giving us a live update on the issue of Lassa fever in Ogun State and debunking fears of any reported case. Moving away from health now, talking